Hello, my name is Dr. Karim Kurji, York Region's Medical Officer of Health. Effective today, York Region has transitioned out of the stay-at-home order and into the red control zone of the province's strengthened COVID-19 response framework. It is expected we will remain in this zone for a minimum of 2 weeks. Although the stay-at-home order will no longer be effective in York Region, everyone is strongly advised to still follow all public health advice and continue to stay home as much as possible. Keep socialization to the immediate household, ensure physical distancing, and wear a mask, and keep your encounters with others as brief as possible if you must leave home. While COVID-19 variants of concern are circulating in our communities, York Region Public Health is confident strong case management and contact tracing, together with your continuing vigilance with public health matters and an increasing number of vaccinations over the next weeks, will help contain these variant strains. Under the modified red control zone, residents are to only socialize with those in their own households and stay 2 meters apart from anyone else, stay at home as much as possible, and only go out for essential visits. All events and social gatherings are limited to 5 people indoors and 25 people outdoors, and physical distancing must be maintained. Businesses must adhere to and post capacity limits, ensure physical distancing and masks are worn by patrons and staff, manage lineups, clean and disinfect commonly touched surfaces, and create a safety plan. Supermarkets and other stores that primarily sell groceries are limited to capacity restrictions based on a formula in the regulation. All other retail stores, including big box retailers and liquor stores, are also subject to reduced calculated capacities. Restaurants will be limited to 10 people total, with a maximum of 4 people per table. Further details of the red control zone restrictions can be found at york.ca/COVID-19. We have every confidence in our residents and local businesses, the majority of whom continue to follow and respect public health guidelines. By working together, we can continue to bring case numbers down and support strong, caring, and safe communities for all who call York Region home. Last week, we shared our COVID-19 vaccine plan at a special meeting of Regional Council. It is important to us to communicate to our municipal leaders and our Board of Health appropriately, but also with you, the public at large, on the immunization plans we have for our residents and those who work in York Region. It's important you see the prioritization which the Ministry has asked us to follow and the extensive planning that has gone into the different sorts of sites, static, mobile, drive-through, and also having outreach activities like strike teams that go into specific settings like congregate living settings for seniors to vaccinate them. This plan involves many partners, including physicians, public health nurses, hospitals, and many other community partners. Reaching our vaccination targets will be a total team effort. It is important for our residents to realize we have a plan, and it includes reaching priority groups of people in a variety of different ways, and we intend to reach all segments of the population. We have representation from many different sectors on our task force for immunization and sensitive to the needs of many diverse and sector-specific individuals. We need residents to know our ability to quickly administer vaccines is based on supply. We will roll out the vaccine as rapidly as possible as supplies become available. We don't want to keep any vaccines in our freezers. We are currently in phase 1 of the province's 3-phased vaccine distribution plan. As part of phase 1, we are now working with our hospital partners to vaccinate healthcare workers in priority sequence identified by the Ministry of Health. The province has also recently updated phase 1 to include adults over the age of 80. We expect to begin vaccinating residents aged 80 plus by March 1st, and more information will be available soon. You can learn about the phases and timing of each phase on our website at york.ca/COVID-19 vaccine. We continue to update this page regularly. COVID-19 vaccines are safe, effective, and the best way to protect yourself from serious illness. This is not a live vaccine and does not contain the virus. Therefore, the vaccine cannot give you COVID-19. After 2 doses, both the Pfizer and Moderna vaccine are approximately 95% effective. It can take up to 7 to 14 days after the second dose to achieve this protection. We are already seeing positive impacts of the vaccine in our long-term care and retirement homes, with majority of residents having received both doses of the vaccine. When it's your turn, we highly encourage you to get vaccinated. Together with our partners, we are all working hard to keep our community safe and to get people vaccinated when we can. But we need the community's support. We must all keep going and take steps to avoid the spread of this virus. Please avoid all non-essential travel outside Canada until further notice. If you test positive for COVID-19, providing all history of contacts and contact information is crucial to limiting the spread. Please be cooperative and kind to our case and contact investigators. We need to work together to keep the virus from spreading to more of our friends and families. You may receive a text message from our virtual assistant with a secure link to complete a voluntary personal assessment form. This text message is not spam. This process will help us to quickly identify the context of cases and get in touch with them quickly. If you have been in contact with a confirmed case of COVID-19, regardless of which strain the virus is, it is essential you stay home and self-isolate for 14 days, even if you receive a negative test result, as we know it can take some time for the virus to emerge even after a negative result. If it is challenging to isolate yourself in your home, visit york.ca/isolation center to learn about our no-cost voluntary isolation center to safely self-isolate away from others in your household. Stay vigilant and stay safe. Thank you.